My name is David Michaels. I'm a professor in the Department of Environmental and Occupational Health at the Milken Institute School of Public Health at the George Washington University. Until early in 2017, I was Assistant Secretary of Labor for the Occupational Safety and Health Administration, the longest serving, or sometimes people say the longest surviving head of OSHA in the agency's history. My background is as an epidemiologist. For many years I crunched numbers for a living, but I was always interested in what you do about those numbers, how you turn those numbers into policy. And over the last 20 years or so, I moved from epidemiology and doing research to the application of that epidemiology. And I've run a couple of different government agencies that are charged with protecting the health of workers or the environment in the country. You know, there are many pressing public health problems in the United States, but one that I'm particularly interested in is the relationship of income and wealth inequality and public health. You know, the lack of income and income inequality has a huge effect on people's health. Premature mortality, all sorts of different illnesses, even the opioid epidemic are clearly related to the economic situation in the country, and not just in the country, but in the world. And so this is an important issue from the public health point of view, and one I think we can address very well from the point of view of the George Washington University School of Public Health and all the schools of public health around the country. So an area that I think deserves greater focus in the schools of public health is worker injury and the prevention of worker injury. Somewhere between 3 and 5 million workers are seriously injured every year on the job. And those injuries have, in many cases, dire consequences for workers and their families. Serious injuries force low-wage workers out of the middle class. And when workers are doing well and in the middle class, a serious injury can throw them out of that middle class and they'll never get back in. This is an area that deserves further research, deserves educational programs and things we can really have a big impact on. And it would make the workplace better and workers' families much better off if we can do something about that area. You know, I think in terms of worker safety, there are some very important research questions. Why do some employers understand that safety is an investment and they become better employers, the companies become more productive and more profitable when they work safely, where other employers look at safety as a cost and they try to minimize it, and the result is that workers get hurt. So I think there's some very interesting collaborations that we can be doing in that world that can have a big impact. Work is a fundamental determinant of the health of adults in the United States and of their families. Work provides income for people to feed their family. Work also provides meaning to their lives. People's self-definition is based on work. Of course, the absence of work has an impact as well. Unemployment, lack of income have very important and deleterious health effects. What public health can do is look at ways we can make work safer and more meaningful, both in terms of the research we do and the application of that research, helping workers ensure that their workplaces are safe. One of the things that I saw as the head of OSHA, and before that in my role as the Chief Safety Officer for the nuclear weapons complex during the Clinton administration, was the power of science-based advocacy. That's taught in schools of public health, but not necessarily taught widely and not necessarily taught well. Public health people who know how to mount a strong argument on the basis of science, understanding costs and recognizing the consequences of what they're advocating for, can have a tremendous impact. And when we teach our students in schools of public health about making change in the world, we need to be showing them how to be strong advocates with the federal government, with state and local governments, with private corporations, with NGOs, everybody who can have an impact. But that's an area that I've seen something that we should be focused on, and certainly something I'm trying to teach more of in my classes. I'm quite proud to be in public health. I know that the work I do and the work my friends do, the work my colleagues do, the work my students do, we can end our day going home knowing that because of our work, we've made the world a better place.